This brings us to an interesting situation where I would like to digress and discuss a patient of mine who was a 40-year-old finance executive based in Mumbai and who had chronic 15 years of neck pain, which eventually led to tennis elbow. Spoiler alert here, that tennis elbow has nothing to do with the elbow. It is because of a weak rotator cuff which has been neglected that leads to a painful elbow. But you must understand that shoulder rehab program also addresses the tennis elbow. He had chronic 15 years pain and came up with neck pain and elbow pain, and nobody recognized that his rotator cuff was weak and deficient. He'd had tons of physio, he'd had short wave diathermy, he had heat modalities, he had steroid injections. Every time he went to a physiotherapist, he got better for a couple of days, but never got cured completely. He was fed up, he gave up his badminton and was almost at the end of his tether. Incidentally, he moved to Pune a few months back and came and saw me, and I checked him up. So I examined his neck, his shoulder and his elbow, and it so transpired that he had an incredibly weak rotator cuff which remained unaddressed. So because he had neck pain, he was treated as cervical spondylosis and fibromyalgia, and that's why he never got better. Now, at 40, he was too young to have cervical spondylosis. If somebody was 60, then cervical spondylosis is a degenerative condition and I can expect them to have cervical spondylosis. But at 40, I don't expect that to happen, and that's why he failed the treatment. So we sat him down and explained to him because of his job, because of his poor posture, and we said that we will treat you with the PSRP shoulder rehab program, where he is required to come in person half an hour every day for 2 weeks. But at the end of 2 weeks, there has to be a finite improvement, and the improvement should be in pain, in movement and in strength. He was ready, he was clutching at straws, so he came over and did a 2-week program, and lo and behold, when he came back in, his neck pain had almost gone, his shoulder was 50% better, and for the first time he was inspired that he is going to get better. So the sum of this was that a clinical assessment was very important to detect the rotator cuff, which can manifest very differently. The rotator cuff is very difficult to rehabilitate because the shoulder is a very challenging joint. Here, what happens is when you're doing a given shoulder exercise or a home program or with a therapist which is unsupervised, then there are a lot of muscles which can compensate for the rotator cuff. So when you're required to use an exercise to train the rotator cuff, it's very common for either the elbow or the neck muscle to come and compensate, and then it will never treat the main problem. So apart from the rotator cuff, all the other muscles get strengthened, and that's why it is difficult to give a result for a shoulder or a neck pain patient. So this gentleman underwent 2 weeks of supervised PSRP, got 50% better, then he was qualified to go on a home program for 4 weeks. He did the home program for 4 weeks, and 6 weeks after we initiated PSRP, he came back and his problem was resolved like magic. At the same time, because of the delay, he also had tennis elbow. You must understand that tennis elbow has nothing to do with elbow. It was because of a compensation of his weak rotator cuff. So at the end of 6 weeks, his tennis elbow also resolved. You must understand that treating elbow in a tennis elbow patient does not move the needle. It has to be understood what is the root problem. So his neck was the victim, his shoulder was the culprit. It is very important, vital and mandated that we must treat the culprit and not the victim.